Hey, Kath, great question about lingering effects of vaccines and genetically modified viruses and things like that. When you think about triggers, triggers are life events, they are vaccines, they are food, airborne substances, physical trauma, anything you think of can be a trigger. And it's not one thing that causes one thing, it's all these things in combination that hit at a certain time that causes a person to be affected by it. When it comes to autoimmunity, we're talking about a self-devaluation conflict that could come from someone saying, oh my gosh, I was told that I couldn't see my grandkids unless I got the jab, the COVID vaccine, and as a result, now I think less of myself as a fact of doing that, going against my morals. I'm just giving you one example, right? There's millions of examples we could go into. The point is, if you think it's any one thing, then you're looking for a silver bullet to blame and saying, this is the problem, this is the cause of my issue. As long as I deal with that, the problem is you're missing a whole umbrella of things that could be happening in combination. But our psychology says if I can blame it on one thing, then I feel better and I can move on. It's not about moving on, it's about getting to the deeper understanding. So yes, can vaccines and traumas from genetically modified viruses, whether in Wuhan, China labs, or wherever, it doesn't matter where they come from. Homo sapiens are 200,000 years old. The coronaviruses have been around for a long time. Whether they're man-made in the lab, whether Borrelia burgdorferi was weaponized by the Nazis, what does all this matter? None of it. Because there are 8, maybe 7.5 billion people on the planet. Not everybody's walking around with Lyme disease, not everybody's walking around with COVID, not everybody's walking around with the autoimmune stuff. That's not what happens, okay? It's the person and their experience and how they interpret that experience and then what they do with it that then determines their health outcomes. That's the big thing. The more adverse childhood experiences you have, the more adverse health experiences you have later on, okay? So rather than try to blame it on one thing, look at yourself as a whole human being. Look at the people you care about as a whole human being and understand that that's toxins and foods and stresses and traumas and all the other stuff that goes into that. And it's the perfect storm like happened in, 91 when, 15 feet of snow fell down. It doesn't matter. All right, the point is, please, I just want to encourage you to not to blame it on one thing, okay? They try to blame autism on MMRs. Not every kid that gets MMR vaccine has autism. It's so much more than that, okay? So just please take a step back, and we applaud you for commenting and asking the question because you're seeking to understand, and that's what we're trying to help you get a deeper understanding of how to understand this stuff, okay? So appreciate your support and your comment, and let us know how else we can help.